Welcome to the second episode about strategic thinking and its framework in medical affairs. Let me quickly remind you that in our previous episode, we defined strategic thinking and detailed a 5-step framework to help us apply it in our daily work, in medical affairs, of course. We also shared one hypothetical example, if you remember, about launching a new oncology breakthrough. Today, we will recall the 5 steps of the framework, and then we will have another example from our field medical team. So regarding the 5 steps of the framework, remember with me: 1, situational analysis; 2, defining our North Star vision and objectives; 3, strategic choices, where we list our options and then prioritize them; and then we come to the execution roadmap, number 4, and the 5th step is the reflection and adapting. Now, we will try to apply the same framework to an example for our field medical teams, or in other words, for our key opinion leaders' medical engagements. But before we start, let me share with you something. Some colleagues may think that key opinion leader engagement is not a strategic initiative. This is a big mistake. The truth is that without strategic thinking and planning, key opinion leader engagements would be ineffective and completely disconnected from the impact. These are very important points. So let's apply now the 5-step framework in this hypothetical example, which is here the medical team is trying to strengthen the key opinion leader engagement in a therapeutic area, let's say immunology. So imagine you are working in the medical team for the immunology portfolio. You have strong data that supports your product, but the field medical team is struggling to build consistent relationships with expert and key opinion leaders because probably you are new to this therapeutic area. This is a common situation. So most of your current key opinion leader interactions are limited to congresses or sporadic visits every now and then. On the other hand, your competitors are moving fast. They have already established their place in immunology. They have digital advisory platforms, collaborative publications with the key opinion leaders, and they have already shaped the narrative in this space, immunology. Of course, you agree with me that this is a very common situation, especially when we launch something new or we are new to the therapeutic area. It is important to highlight that what is risky in this situation is that if you don't really elevate your key opinion leader engagement, you may lose relevance with the key opinion leaders. So now let's see how we can use the 5 steps framework to strategically think how we will elevate our key opinion leader engagement. And we will start as usual with the situational awareness, or call it situational analysis. And this is where we scan the environment. So by starting to think, we can use also the SWOT analysis. We need to cite down or to list that internally our team, as we mentioned, have strong scientific expertise, but they have limited tools for continuous engagements. Most interactions are face-to-face, which means that only a handful of key opinion leaders get consistent contact. Externally, competitors are digitally engaged with many key opinion leaders. There is a rising demand for the key opinion leaders to have more flexible, accessible formats of scientific exchange. Patients and advocacy groups are also becoming more vocal in immunology and in shaping the treatment expectations. So without adapting to this situation, we will risk a lot. So now if we have been satisfied with the SWOT analysis or the awareness, we need now to move to establishing our North Star. And again, if you remember, we said that the North Star is the ultimate objective, and then we need to define 3 or 4 strategic objectives with certain KPIs and time metrics maybe. So let's say that in this example, our vision is to establish ourselves as the most trusted scientific partner in immunology within the next 3 years, which is also a very common strategic objective in medical affairs. So we want to establish ourselves as the most trusted scientific partner in immunology. And to make that vision real, we will set 3 clear, smart objectives. Let's say, for example, we will build sustainable year-round engagement with key opinion leaders. And here we can add, of course, some metrics, quantitative and qualitative. 2, we can generate evidence and insights with key opinion leaders to shape the clinical practice in immunology. 3, we need to expand our influence beyond the top key opinion leaders to include, for example, remote physicians, new patient advocacy groups, and so on. So here you can see the North Star and the strategic objectives ensures that your engagement is purpose-driven. You are not just listing activities, you are hitting in the right way to achieve a vision. Now we come to the third step, which is listing our options and then prioritizing them. Looking at our strategic options, we could increase the number of traditional advisory boards, for example. We could build a global digital advisor platform, enabling continuous dialogue with the advisors or the key opinion leaders. We could also initiate real-world evidence. We can set a plan for educational activities. We can do collaborative research and publish with the key opinion leaders. So if you remember here in this part of the framework where we list all possible options, everything that can be done. Then we start prioritizing based on 2 factors. First, the impact. So the option that will bring us closer to our North Star, that's what we will select. And second is the feasibility. Which option is realistic to be implemented with the available resources? So based on the impact and feasibility, we will select 3 or 4 strategic initiatives, and these will be our strategic choices. Let's say for the purpose of this example that we will set our strategic choice to combine the second and third options that we mentioned. So we will, for example, invest in a digital advisory platform that will run throughout the year, allowing us to interact with experts continuously, not just 2 times per year, for example. Also, at the same time, we will initiate joint real-world evidence studies in partnership with the key opinion leaders to make them active collaborators rather than passive advisors only. We will also stream our key opinion leader operations to ensure that we meet both qualitative and quantitative engagements, strengthening on the importance of expanding to include remote clinicians and more patient advocacy groups. So these are our strategic choices. Now it is time to talk about the execution. The execution roadmap, which translates this vision into real actions. And here is where we define who will do what and when. For example, again, in the first year, if we refer to the same example, we will pilot digital advisory platform in 3 areas. We will engage with a balanced mix of national key opinion leaders and global experts. We will also, in the first year, identify 2 priority research questions by which we will initiate collaborative research to generate real-world evidence data. In the second year, we will expand the advisory board globally, maybe integrate new stakeholders, include patient representatives and payers, so we can broaden the perspectives. And early real-world evidence findings will be published on the second year in certain journals, and this will reinforce our scientific credibility. By the third year, we can leverage our digital platforms to become a recognized forum for exchanging science, in immunology, and our collaborative studies will begin shaping the guidelines and informing policy. This is important. So you see, you cannot influence guidelines or share data that can influence guidelines instantly. You have to wait for the normal progression of the operations. We started the study in the first year, it will start to be published in the second year, and probably its influence will happen in the third year. Remember, every step ties back to our objectives to ensure alignment with our North Star. Okay, and then we come to the last step, which is the continuous reflection, where we monitor and adapt our plan. And as we said, this framework or plan is not static, but actually it's a dynamic process. And in this step, we build the reflection into the process. We track participation rates in digital advisory boards, the quality of insights gathered, the impact on publications and guidelines, and in case that a key opinion leader engagement drops or the metrics drops, we adjust the platform with new interactive formats. If the new therapies questions emerge, we adapt real-world evidence agenda to remain relevant to the current questions. And if competitors shift their strategy, we refine our value proposition to stay ahead. This is the plan on the paper. But if we execute it as step by step like this, the outcome in similar real-world situations, if we apply this framework, we will evolve from being seen as simply organizers of events to being truly scientific partners. And the key opinion leaders will look at this team as not only for data, but for collaboration, guidance, and leadership. Here, we are actually shaping the key opinion leader engagement, building long-term trust, and in the meantime, influencing the opinion in immunology. And this is the power of strategic thinking. It transforms medical from a reactive engagement platform to a proactive future-shaping partnerships. As we discussed in our previous episode, the 5-step framework can be scaled and applied consistently at the country level, the regional level, and also at the global levels. And this would ensure that medical affairs across the entire organization remains aligned, impactful, and organized, and also recognized as a strategic function. Let's see how this framework can look like or would look like at the country level. First, the situational awareness in the country means scanning the local healthcare ecosystem. Answering questions like, what are the national health priorities? Which therapeutic areas are underfunded? And what are the unmet patient needs in this particular country? Where are the gaps in the both clinical practice and scientific evidence? So these are the type of questions that you need to address in the situational awareness at the country level. And if you use this framework, a country medical director or the team can define the North Star that focuses on local needs. Let's say, for example, improving biomarker testing rates, generating local real-world evidence to address the data gaps, or ensuring equitable patient access across the country, comparing the cities with other areas. So when leadership will ask you, what is the medical affairs doing to support our therapy in this country? The team will be ready and can easily point to concrete evidence of impact, such as a registry that generated local data for payers, cross-country key opinion leader engagement roundtables that broadened the clinical adoption, measurable increases in diagnostic testings and patient access. Do you notice how this shifts the narrative from just activities delivered to impact created? And this is where communication skills come into the play, especially when we talk about data storytelling. What about the regional level? How this framework would look like at the regional level? This 5-step framework helps to align multiple countries under shared strategic vision. For example, if we take a region like Middle East and Africa, here the situational analysis might reveal definitely disparities in healthcare systems. For example, some countries need more time to develop their strategic or their digital engagements. Others are relying on face-to-face models. And by the way, this is a real situation. So if you wanted to have a regional digital platforms in this region, you might find a lot of discrepancies between the adoption of technology in the region. So the regional strategy should address the disparities and differences and align them on a regional vision. Strategic choices here might include creating regional real-world evidence platforms that allows data to be pooled across markets, or establishing, for example, regional centers of excellence where key opinion leaders and healthcare professionals collaborate on the educational initiatives. Execution would ensure that while each country adapts to its own context, the region collectively builds credibility and influence. And so when the leadership comes and asks what is the impact of the regional medical team across the region, the regional medical lead can easily point to unified metrics such as, for example, publications from pooled regional data, regional expert consensus statements shaping practice, expansion of scientific exchange into new geographies. Here again, the impact is very clear, measurable, and aligned with the regional health priorities. And all these initiatives and strategies, they are happening since years. The only difference that strategic thinking can add here is to shape the narrative of our communication in a way that matters to the listener, because we speak activities and they listen strategy. We speak science, they listen science, they listen revenues. So we have to adopt a very interesting, let me say, narrative in order to reflect what we are doing and what is its impact. Even at the global level. Globally, this framework can be helpful to provide the discipline to connect long-term corporate vision with evolving scientific health and healthcare trends. So what would the situational awareness be at the global level? Here it means that you need to analyze different global regulatory platforms, changes, payer expectations, emerging technologies such as AI and digital biomarkers. The North Star at the global level may be to position the organization as the worldwide leader in oncology or in vaccine or in any therapeutic area, or to set the global evidence agenda for the entire disease space. So you are sure that you are generating the data that the organization needs. Also, strategic choices could include defining global priorities when it comes to research in general, and to establish international key opinion leader networks or launching multi-country patient-centric initiatives. Execution would then cascade down to regions and affiliates, ensuring they are consistent and aligned. So when the global chief medical officer asks how in medical affairs we are shaping the future of our organization or shaping the future of this therapeutic area, instead of saying that we held 50 advisory boards, we rather say we generated global evidence that supported reimbursement strategies in 25 markets. So you see the difference? One can say we did 50 advisory boards. The other would say we generated evidence that supported reimbursement in 25 markets. It's the same. You want to say 25, you will say it. But rather than saying 50 advisory board, you said 25 countries were supported by this evidence. A big shift. We built the first multinational registry in the disease area, shaping the global guidelines. Or, for example, we positioned medical affairs organization across the globe as the leader in digital scientific exchange worldwide, something that happened during the pandemic, by the way. And that, my friends, is the impact at scale. Showcasing the impact of medical affairs. This is the essence of strategic thinking. The essence of strategic thinking is to ensure that medical affairs is not judged by number of activities, but by the value delivered. This is the main essence of strategic thinking. When leadership asks about impact, you don't show them the calendar of events. You show them improved patient outcomes because of your events. Because, for example, the diagnosis rate increased. Policy influence because your evidence shaped the reimbursement decisions. Scientific leadership because your data informed the clinical practice. And so on. Trust and credibility can also be gained because of strategic thinking, because key opinion leaders and patient groups see you differently. They see you as partners, not as presenters of data. And so if we apply this framework, or any framework, by the way, at the entry level, country, regional, global, medical affairs, it becomes, medical affairs, the deliverables and value becomes consistent, credible, and we have stronger strategic voice. This strategic thinking shifts the conversation from what did you do to what difference did you make. And when you can answer that question clearly and smoothly with measurable evidence of impact, we prove beyond doubt that medical affairs is not just a supportive function, it's a strategic driver of healthcare innovation and patient access. Ladies and gentlemen, it's not easy, but with practice it will become a part of your genes. And as we conclude this session, let me add two essential factors that strengthen strategic thinking in medical affairs. One is business acumen. You cannot be a strategic thinker without understanding what's happening, what is the business acumen, and how you relate to it. The second is advanced communication skills, or what we often called in medical affairs or in healthcare, data storytelling. So together, these three elements, strategic thinking, business acumen, and storytelling skills, these elements together, they make you ready for any conversation. So the next time your managers or your leaders will ask what is the impact of medical affairs, you will not struggle to answer. You will have a clear strategic examples that demonstrate value presented in a very compelling narrative that truly influence the business outcomes. I hope that these two episodes were helpful, and thank you sincerely for your time and attention. I will attach a link to the 5 steps framework of strategic thinking in medical affairs in the description. It's a simple infographic design to summarize the 5 steps of this framework for your reference. Thank you again, and see you next time.